besties, welcome back to the Nurse Aspect, where we assess and evaluate. I am your host, Nurse Becca, and today we have one of my besties on the show, Nurse Trissina.
Hi.
Welcome.
Thank you for having me.
You're so welcome. I can't believe you're here. I love that you're here. We go back so long.
Back.
So long. Oh, gosh.
But yeah, it's all good. We made it here.
We made it. We out here thriving as nurses.
That's
okay. Black nurses.
Okay.
Hello. So why did you get into nursing? Talk to me.
When I was in high school, as you probably know, Wilson Tech, which is a BOCES school, they offered the nursing assistant program. So I'm in high school and I'm like, all right, I'm in 12th grade. Let me figure out what I want to do with my life. So I noticed that program was offered. So I was like, all right, cool. I enrolled in it. And as I'm there, I'm like, I'm really good at this.
Okay.
This might be a thing.
Come on, Black Girl Magic.
Right.
Yeah,
getting good grades, everything like that. Clinically, I'm doing great. So my professor was like, you should really look into making this a profession for you. So that's what I did. I applied to some nursing schools and I realized college is expensive.
Woo!
Very
a word.
Very expensive.
A word.
Especially doing prerequisites. I'm like, I'm going to pay how much a year?
$3 million precisely.
So I'm like, you know what? Let me start at a community college. So I went to Suffolk Community College where I met my girl, Becca.
Hey.
So yes, I did all my prerequisites for nursing there. And then I transferred to Long Island University in Brooklyn.
Okay.
So, here I am.
All right. Well, welcome.
Thank you.
So when you went to LIU, what was that like? Did you like it? Did you feel like it was worth it going there? What was your experience like at school?
So I did my prereqs at Suffolk and then I transferred to LIU. So when I transferred there, I'm like, all right, great. They're going to take all of my credits. There were some things that didn't transfer over. So I had to do like a chemistry class, a math class, and like some history class. So my first full year there, I did an extra set of like prereqs just to get into the nursing program. Once that finished, I was commuting at that time. And then I was like, all right, got into the nursing program, ready to start. I started dorming. Best years of my life.
Okay.
Best decision I ever made.
All right.
And even though it was in Brooklyn and I live in Long Island, it was still a home away from home. It was still learning how to be independent, living on my own, not living on my own, but you get what I'm saying.
Yeah, like your little independence.
Thriving
like
at home. So I think that was really good for me because I was learning how to be an adult while going to school. So, I recommend it to people. I think it's nice to actually get out there. Not everybody can do it, but if you can, I suggest, going, learning how to be an adult, but also, just learning to be in your profession that you're going to be in.
I got it. And just in case for those of you who don't know, Suffolk Community College is a 2-year school and Long Island University is a 4-year school.
Yes.
I completely agree with you in doing it that way, just if you want trying to save some ducats, because school just in general is not cheap, especially if you go to a private school. So yeah, kudos to you. I'm glad you did it that way. I wish I did it that way because babe.
Yeah. Definitely saved a lot of money. And that was really like, essentially one of the goals was to say, okay, if I'm going to be taking this math class here and this math class somewhere else and I'm getting the same type of education, why not spend less money first on the classes that I just need to get into the program and then, spend the real money on, actually going to the school, that I want to be at. Because I did get accepted there straight out of high school, but I was like, why am I paying all this money to do something that I can do at a 2-year school and pay nothing? You know what I'm saying?
So after you graduated, where did you start working?
So after I graduated in 2012, it was rough finding a job. When I tell you I went to every city hospital, I went to every hospital on Long Island. And at that time, applying online wasn't really a thing. So you were going to these hospitals, dropping off your resume.
Yeah.
So me and my now husband, we got in a car. We were like, all right, we're going to Bellevue this day. We going to Mount Sinai this day. We're going to New York Presbyterian this day. I literally went to every hospital, dropped off my resume. So I didn't get a job in an acute care facility until almost a year after.
Oh, wow.
So I got my first nursing job in December of 2012. I was working at a gastroenterologist internal medicine office. And I was working there for about a couple months. And then I finally got a call from an acute care facility. And I was like, finally.
What's it got so long?
Finally. So I started working there in June of 2013.
What was it like working at the gastro office? Did you hate it?
I didn't hate it because I was using my basic nursing skills. So I'm taking blood pressures, I'm drawing blood, I'm doing vital signs, I'm doing EKGs. So it was kind of like I'm going back to my clinical setting where I'm doing all these basic like nursing skills, like learning how to assess a patient and doing urine samples and urine cultures and things like that. So I think it was a great foundation for me to start off with.
All right. And so now you start working at the hospital. Like, what did you start working? What was your field?
So I was hired into med-surg. My recommendation, and this is just me, I feel like having a med-surg foundation, starting off as a fresh new nurse out of college, is one of the best things that you can do because you're beefing up your nursing skills that you learned in school. Going into a specialty, sometimes you really need those foundational skills to do what it is you really want to do.
I feel you.
Learning how to, again, assess your patient, evaluate what's going on with them, assess and evaluate.
Okay, hello.
Okay. But again, learning how to do those foundational skills and then elevating after that, I think are so important.
Totally agree with you because I met so many nurses that started out in their specialty, and I'm not gonna say that they're dumb as rocks. I'm not.
I'll give you a prime example, Rebecca.
Okay, let's talk about. Let's evaluate.
We have a nurse who went straight into a specialty, looks at the blood pressure screen and goes, "Which one is the systolic and the diastolic?"
No. Let's go back to school.
I'm sorry, what?
You need to go back to nursing.
I said to her, "Baby, don't say that out loud."
You know what's so funny?
I said, "Do not say that out loud."
I literally remember you telling me this story, and I was like, "No, no, you're joking."
I said, "Don't say that out loud.
Yeah,
come to the side. We're gonna have a conversation.
Yeah,
and we're gonna move forward."
Yeah,
yeah,
and yeah, because wow, that's alarming.
Yeah. I started in med-surg, and that's where,
because in med-surg, you know which one is a systolic and which one is diastolic. Okay.
So I feel like getting that as a foundation, and again, it's not for everybody. I'm not saying that that's something that you have to do, but I feel like going to certain specialties, you need to have that foundation.
Right, and that's what I'm saying. Like, I don't think people who automatically go into their specialties, I don't think that they're dumb as rocks. What I mean to say is that you don't have that foundation. You don't know really how to assess a full picture. You just know how to assess just what your specialty is. Now, if you work in the ED, that's a little different because you do need to know how to assess very quickly, like your patient. But like if you're going into neuro, if you're going into labor and delivery as your specialty, you're starting off in there, like you just learned those core things you don't know how to do. And it's not going to, maybe it's not a situation that's going to present itself all the time where you're like, oh, I should have knew how to do this, or I don't know how to do that, or maybe everybody on the unit doesn't really know how to do that because all you know is that. Like I think there is benefit in going to med-surg first. Now, if you graduate school, you took your boards and you're like, I want to become an infusion nurse. Well, then I don't necessarily think you need to be maybe a phlebotomy class, something like that. But whatever, depending on, but if you're working in an acute care facility, I think you should just spend a couple months at least in, like, I don't think you need a traditional year, but
6 months.
Yeah.
Transfer out, go and do what you want to do.
Right.
And it's so interesting because I know a couple years back, going into certain specialties, they want you to have that foundation of a med-surg. They'll ask you, have you worked anywhere else prior to coming to labor and delivery, like you said, or going to the ICU or going to like a cardiac unit. They want you to have those foundational steps prior to coming into something so, not elaborate, but, something more.
Yeah. Yeah. I think, and I find that like a lot of, especially like lately, it seems that like it's easier to actually jump into your specialty more than it is like, because before, it was a requirement. Now, not so much. It's kind of like not as hard to get into your specialty, but
well, it's easier now because they offer fellowships for everything.
Right.
And in those fellowships, they're kind of giving you that little quick foundation lesson of this is what your patient looks like. This is what you need to look out for. Okay, now we're going to push this baby out.
Yeah.
You get what
Right.
I'm saying?
Right.
So I feel like nowadays it is definitely easier to get into a specialty, like you said, because they fresh out of school, they're giving these fellowships and people are just jumping right into it.
Right.
Like,
Right.
I don't want to do med surg. I'm going to
Yeah.
go do this and I'm going to be fine.
Yeah. Right. And like I said, apples and oranges. I feel like it's, you can do it, but I just think that it does make you a stronger nurse if you do have a med surg background.
Right.
So what are you doing now, or where did you go from there?
So I worked on the med surg unit for about 2.5 years.
Mm-hmm.
And this is my story, my personal opinion. Med surg does take a lot out of you.
Mm-hmm. Whoa,
and
it beats you down.
It takes a lot out of you.
I'm not gonna lie.
There were times where I was coming to work and I wasn't liking my job.
Mm-hmm.
I love being a nurse.
Mm-hmm.
I was not liking my job.
Mm-hmm.
And I was coming to work like, I don't want to do this anymore. I need to find something different.
Mm-hmm.
I also was getting a lot of post-op patients.
Mm-hmm.
So I'm like, okay, I have this patient who just had an amputation. They're having this phantom pain. They have all of these things going on. How did they get here?
Mm-hmm.
What was their prognosis to have this operation performed on them? That's how I started becoming interested in surgery.
Mm-hmm.
So now I am currently in the operating room.
Mm-hmm.
So again, I applied to the perioperative services, and I applied one day. I got a call that same day, like, "Hey, we're hiring."
Oh wow!
Yes.
Okay.
Same day.
So we're not waiting. We didn't wait a year. Okay.
I got a call same day. I did a phone interview with the director.
Mm-hmm.
She was like, "All right, great. Do you want to come in for an in-person interview?" I came in 2 days later. I did my interview, and I was hired.
Okay.
It was the best decision that I ever made.
Mm-hmm.
Surgery is life.
Okay.
You come in, you meet these people, you assess them very quickly, and that's why I find med surg to be so important, because I'm able to do a head to toe assessment on somebody and know what's going on with them while having a conversation with them and interviewing them while also talking to their family.
Yeah.
So I'm able to tell, okay, they have this, that going on. Their blood pressure is high because they either have hypertension or they're just extremely nervous because they're about to go to sleep for a major surgery.
Yeah.
So this was 2015 that I applied and I've been working there, and we're now in 2024. So from there, I was a staff nurse. I learned how to do charge, so I was a charge nurse. And now I'm the nurse educator.
Come on now.
And the operator.
Education, you better teach us something.
Surgery, again, I love it. You get to see people come in one way and they come out another way. It's like you're healing them, maybe sometimes 30 minutes, depending on how long the surgery is. Sometimes it could be an all-day procedure, but I feel like that 5 minutes of crucial interviewing time that you have with them, you're really building a bond with somebody, and they're literally giving you their life in your hands and saying, I trust you. I need you to be here for me when I go to sleep. So I feel like that's something that I really love to do.
What's your favorite thing about the OR?
My favorite thing, the teamwork, the camaraderie, the fact that I know I can't do my job without anybody else. I can be a circulating nurse or I can be a scrub nurse. As a circulating nurse, me and my scrub tech, we're like this. If I'm scrubbing in with the surgeon and I'm passing off the instruments to him, me and that surgeon, we like this. He needs me, I need him, I need my circulator. So I feel like that teamwork and that knowing that us working as a team, we're going to heal this patient. And sometimes the outcomes aren't always that great, but at least we know we went in, doing the best that we can for these patients. With that comes advocating for your patients. Your patient's going to sleep. They fully trust you to be, their eyes and their ears when, they're not able to be. So I feel like that gives me a sense of like pride knowing that, this person trusts me enough to take care of them when they're not able to at that moment.
Okay. Do you hate anything about the OR? Or like what's your biggest pet peeve about the OR?
My biggest pet peeve
as a staff nurse, not as an educator.
Okay, as a staff nurse, my biggest pet peeve is, and this comes up a lot, people don't think OR nurses are real nurses. I say that to say people say that OR nurses are not real nurses when they are.
Mhm.
Again, I'm going to bring it back to assessing and evaluating your patient.
Yeah.
I come in, I meet you in the pre-op area. I need to look over your chart. I need to look at your lab work. I need to look at you. I need to know what's going on with you like this.
Mm-hmm.
Let's say that's a scheduled surgery. Now I have a trauma coming.
Mm-hmm.
I'm doing boom, 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 boom.
Yeah.
If I wasn't a nurse, how would I be able to assess and evaluate my patient
Listen,
and know what's going on?
you know what? I actually love the fact that you threw out this like misconception, because I feel like there's a lot of misconceptions about a lot of different specialties.
Right.
And you do hear that a lot. Like, if you go into the OR, you lose your nursing skills. Like, don't go into the OR because of that. But actually, we're starting out with assessment. Like,
Yes,
we're starting out right at the
100%.
top. Like, you know, from the top, like you are assessing your patient. And so I love that you said that. You guys, I mean, I feel like any kind of nurse is as a nurse. Like, you're still a nurse at the end of the day.
Right.
Our roles may be different. Like, you know what it is? I feel like, okay. In the hospital that we work at, like, when I was working on med-surg, like, my med-surg unit was very close to the OR, right? Coming from med-surg, I would have like 6, maybe 7 patients, whatever. So I'm on my feet running, answering the phones, the labs calling me, telly's going off, like, whatever. And then I happen to look down the hallway and I see OR nurses chilling, like, and I'm like, I'm doing work, wiping the sweat off my face, like I could barely see with my oily skin. And here y'all are like, oh, Becky, you want some coffee? I actually don't have time for coffee. You have time for a sip of coffee? I can't even pee. And I'm looking at y'all like, what y'all assessing right now? Y'all assessing Starbucks?
So maybe we are.
That's what it's giving, you know.
A little DoorDash.
But
I will say, to your point though, there are some days where it may not be as busy in the operating room.
I know.
But then there are those days where I'm in a transplant surgery from 7:30 in the morning to maybe 10:30 at night because it didn't go as planned. I will say there are many procedures where I'm going nonstop.
Yeah.
Again, we do work at a level 1 trauma facility. So I may be done with one procedure. I may be setting up for another one. And then they're like, you know what? You're not doing that anymore. We have a trauma coming up. I need you to switch and do that. So that's where I feel like, too, when they say we're not nurses, critical thinking comes into play. Because now I'm like, all right, this patient may be coming up with a gunshot wound to the abdomen. What do I need? How is this patient going to come up? What do I need to do for anesthesia? What kind of blood products are they going to need? Now this patient comes into the room. I need to be able to look at that monitor and assess what's going on.
Yeah.
I need to look at that pressure. I need to be able to kind of just silently be in sync with my surgeon and my anesthesiologist, because they're going to rely on me to be like, all right, she hears this beeping going off. She knows that the blood pressure is tanking, so I might need some sort of product. I need to be able to listen and say, okay, what do I need to do? Or have certain things available. So we are nurses.
Y'all are nurses. You know what? I will say, working in labor and delivery, where I do get a little taste of the OR. Like, just things can change very quickly.
Yes.
So I completely get it. Yes, you do. There are times, depending on where you work, that you could have a lot of downtime, but when the time is up, it's up, baby. And it could be up for the entire shift. It could be up for the next couple of days, like, or whatever. So I totally get it. So now that you work in education, when people do come into the OR and they're like, let's say like you have like staff that comes in like, oh, great, I'm glad I wanted to get out of med surg, or maybe they started there and they started and like, this is not what I thought it is, and now I want to leave. Like, what do you say to those people? Like, what do you think the issue is?
So some people do come in with a misconception that the OR is easier. I'm going from having 6 and 7 patients to 1 patient. I tell them, yeah, you had those 6 and 7 patients. You're running around, you're moving, you're grooving. Now you have this 1 patient, and that 1 patient will probably have you running just as much as those 6 to 7 patients may have for the full 12 hours of your shift.
Yeah.
But I also tell people who do come in from the floor and aren't coming into the OR with no knowledge of nursing, I say to them, it's a completely different type of nursing. So I want you to take that idea of nursing that you have in your mind, set it aside, because now you're going to be learning something different, a different type of nursing. And that's what I had to learn for myself too, because I came into the OR like, I'm used to putting in IVs, hanging antibiotics, doing wound care, doing this, doing that. And I had to say, there's another discipline in the room who does that, which is the anesthesiologist or the
Yeah.
CRNA.
Right.
So, but I also had the knowledge of, if I see that they're having difficulty putting a line in, I can say, maybe you should try this gauge instead of that one. Maybe that'll help.
Mhm.
And sometimes it is helpful because I have that knowledge of that.
Yeah.
Or when they're putting in lines, I'm able to assist them and say, okay, you got the line in, let me hand you this tubing because I know that's what you're going to need next. I know that you're going to have to tape this down. Let me hand you this next. And they're looking at me like, how do you know? Because I have this background.
Yeah.
So I do tell people, it is a different type of nursing. And some people do come into the OR and be like, this isn't for me. This isn't what I expected. I'm going to go back to where I came from. And I always tell people, that's completely fine. Nobody's going to judge you or, patronize you and say, why did you come here? This is what it is. I always tell people it's not for everybody. Some people will come in and they're like, that's blood just continuously dripping out. Not for me. They'll go into ortho and they'll hear the banging and the clacking and all of that. And they're like, I'm sorry, they're using an actual mallet and a hammer and all these things. Well, they're not using a hammer, guys, but like the drilling and stuff like that.
Yeah.
They're like, this isn't for me. We do recommend people coming in and shadowing and seeing what it's about. Following a circulating nurse to see, okay, I'm going to get my patient, I'm assessing, I'm setting up my room, I'm getting these instruments ready. So we do recommend people who say they're interested in the OR, come shadow, come see what it's about first before making such a major decision about leaving where you are to come here when you think that it's easier.
Yeah.
So,
what do you love about being an educator?
I love seeing people come in as a novice perioperative nurse and growing and thriving and saying, wow, you started here, look where you are now.
Yeah.
And it's so interesting because our fellowship program is a little extensive. So it's like over those months that you're learning, I always tell them, look where you're starting now.
Yeah.
You're nervous, you're scared, you're this, you're that. And then at the end of their orientation, I'm like, so remember that first day when you said, Triss, I can't do it. This is too hard. I'm scared, blah, blah, blah. Look where you are now.
Yeah.
So that's kind of what gives me pride is like, I got it, y'all, through this. Y'all got this.
Raising babies.
And I honestly, I keep it very level with them. I don't make it, I'm here and you're there type of deal. We're here. I want you to be able to talk to me. I want you to know that I'm your support system. You have questions. If it's something personal going on at home, I want you to talk to me about it because how you're feeling from the outside is going to affect what you do in here. And if we can sit down, have a quick conversation, you tell me, you know what, Triss, my dog pooped all over the house today and I dropped my Starbucks on the way in. Now I have an attitude and you're bringing that energy in here. That's going to affect how you take care of your patient.
Yeah.
So let's talk about it. Let's have a conversation and let's get to where you need to be for the day. So, and they love me. Like,
I love you, so I'm not even surprised. Always keeping it real.
Okay.
Do you see yourself ever leaving your position? Like, do you want to, like, where do you see yourself going? Like, is this like it for you or like?
I see myself doing clinical teaching for like colleges or universities.
Okay.
I do love the operating room. I do love educating in the operating room, but I do feel like that this isn't the end of the road for me. I don't feel like this is, all right, I'm an educator. I got my job, I'm good now. No, I feel like I'm going to,
keep progressing.
Level it up.
Okay.
I do plan to go back to get my doctorate. So, call me Dr. McDonald.
Okay.
But I do plan to go back to get my doctorate so that I can do, teaching in a school and things like that. See where it goes. If it's for me, it's for me. If it's not,
listen,
then it's not.
What's for you will always be for you.
Right.
That's what I know.
So
I love that. All right. Well, listen, when you get your DMP or when you're back in school and you want to talk about what that's like or whatever, balancing work life and stuff like that, you're more than welcome to come back on the show.
Definitely.
Okay. All right. So now come to a show where we talk about the nurse's note. So nurse's note, for those of you who are new, is where we talk about things that happen to us. As nurses, we have to always document and literally tell a story of what is happening with our patients, how we're interacting with our patients. And the nurse's note on the nurse aspect we are telling and documenting our own story, things that happen to us that we want to share, pass on, make us feel good, or, whatever it may be. So, yeah, welcome to the nurse's note on the nurse aspect. And what is your note, my love?
So I'm gonna give you guys a little story, a little background of a situation that happened. Um, this is probably 3 years ago now, maybe even a little bit longer.
Pre pandemic?
Pre-pandemic.
Okay.
Pre-pandemic, yes. So I'm in a room. I'm a circulating nurse at this point, and I came in to relieve somebody to go to their lunch break. So she's giving me a report, patient's name, date of birth, things like that, what procedure we're doing, what the next procedure is going to be. Because at that point that I came into the room, the case was going to be finishing soon. So she's just giving me a rundown of what's to come next, where the next supplies are, things like that. So the case comes to an end. Drapes are getting ready to come down. And the surgeon says to me, "This is what we're doing next. Make sure you have this, and that in the room." Okay, cool. No problem. I go and I look on the shelf where the supplies are already there. So I look and I say, "Okay, we don't have this in here. I'm going to make sure that I have it for your next procedure." And he goes off, flies off the handle. F this, all types of curse words, everything. This is how he's talking to me. And
Lost his mind.
Yes, he did. He lost his mind. And he was like, "All you guys do is effing sit around and talk about this and that. Y'all not paying attention, blah, blah, blah." And I'm here. I'm here. And I said, "I understand all that. I received a report. This is what she told me. I checked. It wasn't there. But I also told you that I would go and get it for your next procedure. The drapes are down at this point. The patient is now waking up. So now you're doing all this hooping and hollering while your patient who's under anesthesia is waking up." I'd like to make a note that waking up from anesthesia is one of the most critical points in a procedure, because things can go south very quickly. Mm-hmm. So while you're doing all of this with me, I need to go and tend to my patient, which I did. Patient wakes up, everything like that. He's still going on. So I come to the side with him and I said, "I understand you're upset. I need you to take a minute. Maybe you need to step outside, get yourself together, come back in. We'll have a conversation like adults. But I don't appreciate the way you're speaking to me." Cool. Steps outside, comes back. 2 minutes later, same energy.
"We're not ready."
I said, "See, we had a conversation. I asked you to step outside, get yourself together, and come back in, and you're still yelling at me. We're not doing that today. Not today." I said, "I think you need to go back out and get it together." And he left. And eventually he did come back, and by that time I went on to my next break. I had a conversation with the service line manager. I let her know what happened. I told her I don't appreciate him speaking to me like that. It's inappropriate, especially at the fact that you're talking to me this way as your patient is waking up from general anesthesia. A week later, I received an email apologizing for the way he spoke to me, and just saying that it was unprofessional, it won't happen again. Please accept my sincere apologies. So with that being said, I feel it's very important as nurses, and I'm going to throw this in there, especially Black nurses, to always keep your cool no matter what the situation is. You can professionally read somebody, professionally bring them back down to their level. You're a surgeon, but that doesn't mean that you're here and I'm here, because we're always going to be here, because you cannot do your job without me. And I make that very clear. Always keep it cool, no matter how you're feeling deep down inside. You want to box them out, try to just keep it to a level where you show that you're not the aggressor, because they will say, "Well, you did this and you did that. Even though he was wrong, you said this and you did that and you acted this way." No. You're not going to catch me like that. I kept it as professional as possible. And he knew that. And that's why he gave the apology that he gave. So, right?
Keep it professional
and cute.
Okay. And that is so important though, because sometimes it's really hard to control your emotions, like especially in a high tense situation like that. So I love that you did that. Now, me knowing you personally, I know.
Don't you do that, Becky.
I know that, and I feel like this can go both ways. I'm not even just putting you out there, because I feel like we all know someone like this, or maybe we are that type of person that will be like, okay, I I'm real like, yes, Dr. Smith, I understand what you're saying, but it could be, look now, Dr. Smith,
Yes.
hello,
Yeah.
I'm gonna gather you right now, like, but I also know that I have a job, and
But there
I have
also
bills.
are some days where I will be like, they'll say certain things to me, and I'm like, I'm sorry, who are we speaking to?
Yeah.
I'm sorry, you need what?
Sometimes, I'm not gonna lie, like I said, sometimes, and that's just, I feel like that just comes with time. Like,
Yeah.
I when I first started nursing, period, like I'm a talker. I know that like I like to ask questions, I like to get myself involved in things and whatever, blah blah. I can be very nice and stuff like that. But initially when you get into any type of confrontation with anybody, any type of conflict, it's very easy as a new nurse to be like, okay, I have to take it on the chin or whatever. It takes a while for you to build up that confidence, for you to be like, to stand up for yourself. Now, standing up for yourself doesn't mean you gotta be like, all girl, all high and mighty, because you can do that and also be very wrong and whatever. But standing up for yourself, where like you're keeping a profession, like I want you to understand that we have the same goal in mind, our patient, like whatever. If in your situation with Doctor whoever, Doctor Surgeon, like, okay, we didn't have what you needed, but I'm telling you, whatever. Now, if you're not ready to receive that,
right,
that's fine, whatever.
Like
but actually, exactly, it's very personal, and I'm not going to get personal with you because I have bills to pay, and whatever. But even if that wasn't the case, like it just, there's a level of professionalism that you do have to have as a nurse, but it's very easy to get out of that.
Yes.
Yeah.
And I tell my orientees, I say, because they'll go into the rooms and they'll see how the surgeons act, and they'll see how their seasoned nurse who's training them, how they respond to them. And I say, you'll get there.
Yeah.
I said, but don't ever let anybody disrespect you. I said, you have to remember that you're there for your patient. So always keep that in the back of your mind, the purpose that you're there for, but also never let anybody disrespect you, and you stand your ground. I said, you're going to get to that point where you're like, see, we're not doing that today, sir.
Yeah.
It seems scary now, but you also have to be able to, hey, listen, we're not doing that. We have Jane Doe on the table we need to take care of. We can talk about this later, but right now, this is the importance. Meanwhile, you're not going to talk to me like that.
Yeah. And I love that.
I love to give a good eye, too.
I know you do, girl. I know you do. I know you do. Okay, because gathering really needs to be your middle name. Okay, I will gather you together. Okay, whether you like it or not. Okay. But thanks for coming. Do you have a tip that you want to share, or was that tied into your tip?
That was tied into my tip. But I do have another one.
Okay,
just don't stay stagnant. Always elevate yourself. Always see what's out there. Nursing is has such a broad, just field of everything. You can go into a little bit of everything with nursing. So never doubt yourself that you can't do something, or that field isn't for me, or never feel like you're stuck somewhere.
Yeah. All right.
Elevate yourself.
Okay, that's
Assess
a word.
And evaluate yourself.
Okay, hello. Okay, besties, you hear it? Thanks so much for coming on the show.
Thank you for having me.
I love this. This is so great. I love when I have my real, friends that I grew up with and whatever. Like, I literally seen you go from single to married, mom, whatever, and all doing it, holding it down. Holding down POP. But thank you so much for coming.
Thank you for having me.
Definitely come back. You're more than welcome.
Of course.
We love to have you.
I'll be back. Don't y'all worry.
Okay. Okay. Listen.
Recurring guest.
Maybe. Okay. Recurring guest. Okay.
Seasonal.
Thank you so much. I love this.
Love you.
That was it.
Yeah.
How do you feel?
Oh,
Are you okay?
Yeah. I hope it's okay.
So good.